Hello friends, you must have heard about total knee replacement, but today we are going to talk about unicondylar knee replacement or partial knee replacement, also known as microplasty. How is it different from total knee replacement? What are the indications? What are the results after UKR, and in which patients we should do that? Let's know from Dr. Prathamesh Jain sir.
Unicondylar knee replacement procedure is a very unique procedure which can give amazing results to the patient. Basically, in most of the cases of osteoarthritis, only the inner part of the joint, which is called as the medial joint, is involved. The rest of the joint is normal. The ligaments are normal. The meniscus are normal. Hence, whenever we can do a unicondylar knee replacement, it is better for the patient. So the size of the joint is very small as compared to a total knee replacement. The cuts that we have to make to put the implant into its position are also very small. So bone preserving. The incision that we have to make to put the implant is also very small as compared to total knee replacement. So small incision. The time that we take to do a unicondylar replacement is also less as compared to total knee replacement. So faster, quicker procedure. It is a procedure which preserves the natural anatomy of the knee. So the ACL, PCL, LCL and MCL, all the four joints are preserved. The lateral meniscus is preserved. The patellar-trochlear joint is preserved. The lateral joint is preserved. So basically the patient have a much better natural knee feeling as compared to a total knee replacement procedure. Also, because the surgery is a smaller surgery, the chances of post-op medical complications like need of blood transfusion, heart-related issues, chest-related issues are very less. The patient rehab is very quick. The patient can be started to walk the second day, to climb stairs the next day. Plus, because it is a knee preservation kind of a surgery, all of the knee structures including ligament and meniscus are intact. That's why the functionality of a unicondylar knee replacement is much more as compared to a total knee replacement. So the patient of total knee replacement normally is able to do brisk walk, he is able to walk normally, he is able to do normal related activities. But the patient we are doing unicondylar knee replacement, he is actually able to do cycling, he is able to do jogging activities, he can able to do a minor sports. So the activity, the agility of the patient is much more as compared to a total knee replacement.
So we are basically knee preservation experts. So we generally also do HTO a lot.
Yes, obviously.
In a lot of amount. So how is HTO different from UKR? When do you choose HTO and when do you choose UKR?
So when there is a bone to bone arthritis, when the bone is touching the bone and there is full thickness cartilage defects on both femur and tibia, in those scenarios, unicondylar knee replacement is beneficial. In rest of all other cases, when there is a root tear, when there is a solitary condyle injury on the femur, on the tibia, knee preservation surgery, that is the root fix HTO, is a very good solution. So I would do a unicondylar knee replacement for a more advanced damage in the knee as compared to a root fix HTO procedure.
And sir, how is it different from TKR as an indicated to the patient?
So most of the patients in which there is a single condyle involvement, we can do a unicondylar knee replacement. But we cannot do in all the cases in which we can do a total knee replacement. So if the lateral joint is damaged, if the ligaments are torn, if the patellar-trochlear joint is bad, then total knee can be done and unicondylar knee cannot be done. So hence what we do is we do three things in patients in which we plan to do a unicondylar knee replacement. First, we get a good AP and lateral X-ray. Second, we get an MRI of the patient which will give us an idea whether the ACL, PCL and other joint ligaments are normal. The other joint line, that is the lateral joint, lateral femoral condyle, lateral tibial condyle and the patello-trochlear compartment is normal or not. So MRI will give us a very good reading about the condition of the joint inside. And the third thing we do are blood tests, because if there is an inflammatory problem in the knee, a rheumatoid arthritis, then the unicondylar knee will not be successful. So you should have a normal ESR and CRP and you should not have any evidence of any rheumatological disease to do a proper unicondylar knee replacement procedure.
And sir, is there any specific age performing UKR?
No, so UKR can be performed in a younger patient like 50s. I would not do it for less than 50-55. In those cases, I would rather do a root fix HTO procedure. So you can do it between 50 to 60s. and you can do it in higher age individual like 70, 80 also, because it is safer medically. So this is also done in patients who are higher age, who have medical problems, who have problems in heart, like chest related problems. Then in those patients in a higher age group also, if he fulfills all the other recommendations for the partial knee, like intact ligaments, lateral condyle normal, patellofemoral normal, then in those scenarios we can do it for a higher age group also.
So all the patients who have arthritis every time doesn't need a TKR.
Yes. Microplasty can be done in lot of patients. You can save knee from total knee replacement in many cases.
Then also, sir, the rates of TKR are higher than UKR.
Yes, because it is a skill dependent surgery. The skills of performing a UKR is not that common. So not every orthopedic surgeon is trained in doing a UKR surgery. There is specifically formal training to do this particular procedure. So this is very, very important. So one is training, and second is also the need the indication is also not 100%. So approximately all patients in which we can do a total knee replacement, only 50% of them we could be able to do a partial knee replacement procedure.
Okay, sir. So basically the diagnosis of the patient regarding what does the patient specifically need,
Is
like
very, very
HTO
important.
or
Yeah.
UKR or TKR
Is very important, and the decision making is more important. So I would rather recommend a patient to go to a surgeon which is doing all these 3-4 procedures. Normally, most of the surgeons are like a solid dedicated joint replacement surgeon, or a dedicated arthroscopic surgeon, or a dedicated microplastic surgeon. That is not good. A surgeon who performs all the 3-4 procedures equally will be able to give you a better advice regarding yourself, whether which procedure will be the best procedure in your particular case.
So basically there are a lot of knee surgeries that are possible with the pathologies that patients have, but to decide which exact surgery is applicable to which kind of pathology, you need an expert, and the expertise of arthroscopy plus orthopedics, you have to choose that doctor. So do send your MRI reports, X-ray reports on the given below number. Thank you very much.
Thanks a lot.